Council will hold an inquiry into the medicinal use of cannabis. You might have been following this story over the last week or so. The idea for the inquiry was proposed by Ruth Forrest, the independent member for Murchison, and in a telephone hookup, the members of the council supported her. You might also follow that the state government's rejected the proposal from a local company to trial the growth, processing and administration of medicinal cannabis in conjunction with the University of Tasmania. But Ruth Forrest says that the government is wrong not to consider the proposal, and she joins us now. Good morning.
Good morning, Sarah.
Thanks for your time. Why is the government wrong to reject this idea of a trial?
Well, Sarah, I really say they're wrong or not. They've obviously decided not to do it at this stage. I think there's growing evidence that medicinal cannabis has many benefits for patients, particularly those suffering from quite unusual conditions in some forms of epilepsy, in pain management, and also in nausea and loss of appetite associated with chemotherapy, for example. So there's a range of areas that patients with these very challenging medical conditions are not getting relief from traditional medicines. And where the evidence is there that it does actually provide relief for them, we should actually be looking at that as one thing, but also the opportunity to grow the medical cannabis in Tasmania is, again, another opportunity for a primary industry in this state, which we desperately need. And also the trial to allow that to happen would be a benefit for Tasmania to prove it up, and also to create jobs and provide a product not only needed in Tasmania, but there is great demand around the country and around the world.
So what would a committee, an upper house committee inquiry do?
Well, what the committee is going to look at is what barriers and challenges there may be, or there are, in Tasmania to actually allowing, firstly, patients to actually access it. There need to be some changes to our legislation to enable that to occur. And that there's obviously some processes around that with approval for medications to be used, and we need to understand that fully. And also we need to look at the barriers and legal implications for growing medicinal cannabis in the state, and what sort of would be an appropriate regulatory framework. Now, because we've got the runs on the board, I guess, with the poppy industry growing opioids, which are quite actually more dangerous in their raw form than the marijuana or cannabis is, then we've got a framework there already. Now, whether that's appropriate or whether it needs to be modified was something the committee would look at. But the International Convention on Narcotics does cover cannabinoids as well as opioids.
I guess one of the issues here is that when it comes to something like security, and that's the government has cited that as a reason, public safety, is that when we talk about medical cannabis, we're talking about sort of siphoning off or getting the sort of particular parts of cannabis, the composition or the compounds of cannabis that particularly bond with the pain receptors in the brain. So it's not just smoking cannabis and getting high. It's a completely different thing. But on the other hand, I guess with the poppy, it has to be processed in order to get that medicine out, although there unfortunately have been a number of deaths from people trying to make tea. Is the issue here that people, if they did get access to commercial hemp, for example, or marijuana, is that they could use it straight without having to go through any processing?
I guess that's a concern. That's why we need to look at the most appropriate regulatory framework to avoid that happening, and having people who shouldn't be accessing it or are seeking to access it purely for recreational use, which we're not talking about, that doesn't occur. Whilst it won't kill somebody, as unfortunately the opium poppies and CBAM poppies in particular can and have, it's still a serious public safety issue, and I agree with that, and I'm sure the rest of the committee does as well. But what we're looking at here is to say it's not just about smoking marijuana. In fact, I'd prefer that was not the method of administration at all, because of the other complications with inhaling smoke products with a smoke base. So we're also looking at the formation of tablets or some sort of oral medication in liquids, sublingual medications, perhaps they go under your tongue and absorb that way, vaporising it, even suppositories and other forms of administration which are well used for a range of medications now, because we need to look at all those avenues of administration, because it's not just one form that will meet the needs of every patient.
There were a couple of New South Wales MPs who came to Tasmania last week who visited poppy processing plants in Tasmania's north to research their bid to legalise medicinal cannabis. Do you feel that we could miss the boat here? Is that what prompted your call for an inquiry?
Well, that was one consideration, certainly. We've got at least one company that I'm aware of. There may be others who are interested in growing medicinal cannabis in the state. And if we can't, in Tasmania, allow that to occur, then obviously people will look elsewhere. And we know that in New South Wales there is a private members bill that's due to be debated very soon to actually facilitate some of this progress. And so I'd hate to think that we're going to lose an opportunity in Tasmania because we're not prepared to be open-minded and act on this, particularly when the new government has come in with a mantra of open for business and it's all about jobs.
So just in terms of the committee, as I said, the other members of the upper house supported your call for the establishment of a committee. What happens next? Like, how soon will it get underway?
Well, so it's actually a committee of the Legislative Council. So it's 6 members of the Legislative Council, not the whole membership. Just so we clarify that, I guess it's Government Administration Committee A, it's called. And we will now advertise in the newspapers at the end of this week for submissions. On the committee website, there will be an avenue to people to access the terms of reference and to provide written submissions should they choose to. Once we have the written submissions, so we're giving a time frame about 5 or 6 weeks for that, because with people being away often at school holiday times, that sort of thing, there may be people who need that extra time to prepare submissions. And then following that, we'll be having public hearings, as we do with most other committee inquiries.
And then what, with the aim of putting together a report and tabling that with some recommendations either way?
That's right. We'll certainly put together a report which will no doubt contain findings and most likely recommendations as well. But until we actually get into getting the evidence from various people and stakeholders, it's a bit hard to know how long that will take and what form that report may take.
Thanks very much for speaking with us this morning.
I appreciate the opportunity, Sarah. Thank you.
Thanks. Ruth Forrest